This video will guide you through the steps you need to take to clean the skin around your child's trach. First, wash or sanitize your hands. Gather all the necessary supplies on a stable work surface near the child. Here are the supplies you'll need: cotton-tipped swabs and water, 4x4 gauze or a washcloth, 2x2 or 4x4 split IV gauze depending on the size of the child, a self-inflating ambu bag connected to oxygen and face mask, and a blanket roll. In case suctioning becomes necessary, you'll also want a suction machine, a surface suction device like a little sucker, acorn, or tulip, saline bullets, and a tracheal suction catheter. If your child was sent home with a pulse oximeter, now is the time to place them on the monitor. The supplies provided by your home care company may be different than the ones you see here. Your home care company will review your specific supplies with you. Before starting the process, wash or sanitize your hands. Whenever you perform care to the tracheostomy, it is important to check to make sure your child is breathing comfortably. If they need suctioning, do this first. Place a blanket roll behind your child's shoulders to get a view of the neck and tracheostomy site. If there is a humidifier, trach collar, or other device on the tracheostomy tube, it is okay to remove this during trach care. If your child is on a ventilator or oxygen, it is important to leave the tubing in place. Remove the old split gauze while stabilizing the trach. Look for any drainage on the gauze. Take note of any blood or pus on the gauze and update your nurse if you have concerns. Look at the skin around the stoma. The stoma is the opening in the skin. Look for sores, redness, or granulation tissue. Granulation tissue is overgrown, fragile tissue that bleeds easily. Let your nurse know if you have any concerns about how the stoma looks. Wet a cotton-tipped applicator with water and use it to clean the stoma site beneath the wings. Always keep one hand on the trach to hold it in position and allow to dry. Avoid covering the trach tube opening. If you see any drainage or oozing from your child's stoma, apply a new split gauze which will help wick moisture away from the stoma site to prevent damage to the skin. You can use 2x2 split gauze for babies and 4x4 split gauze for children or adults. If the tracheostomy stoma is healed and has no drainage or bleeding, no gauze is needed. Use a cotton-tipped applicator to help you insert the split gauze while stabilizing the trach with the opposite hand. A tweezer or clamp can help you pull the gauze into place. Make sure your child is breathing comfortably during the cleaning and after you are finished.